Okay, well now, that's a little something more, but again, this is something that you have to be very careful about. I personally will not do healing again of any description if it has to be charged for. I made up my mind that in future I shall not do any healing except on the basis of donation. And if the moment that you start to charge anything, you can get into big trouble, inwardly and outwardly. Yes? Yes. Delaware used a magnet for the initial tuning in of the blood spot, and then resistors for the rest of it. Bhattacharya? Yeah. Yeah, well, you've got to be very careful with material. That's another thing. Your healing sanctuary needs a good little library. Needs a library of anatomy books for this sort of thing. If you're a very good group leader, you should be able to brief your healers. Go into this huddle that I was just talking about. Now, let's all get this picture quite clearly. We have an elderly lady here. She is 84. She is suffering from senile dementia. She's a little disoriented. She has poor memory. Her hearing and her faculties are beginning to go. She's a little incontinent. What can we do for her? Straight away, the healing group's got the picture. And immediately it helps. And this is what I want you to do. To learn to take case histories, to get a picture of the individual, so that the whole healing group understands what's involved. Then they bring their multifarious healing qualities to bear on this particular little old lady who needs a little bit of help with her hearing, or you may say, and again this implies tremendous necessity for silence, you may decide that this old lady really has had enough and she would like to withdraw, and that the soul is breaking links, and you can then, as a healing group, assist this very fine person soul to withdraw from that incarnation. Now you can hardly let that out abroad, can you? Question. I really think this is the time for you all to ventilate the various questions that you have about healing groups, because it always happens wherever an area is struggling to establish healing groups and so on, that mistakes are made. And I'm giving you now the benefit of nearly 30 years of work in the field of healing, and I've seen groups rise and disintegrate before they even got down to the word, to the healing, let alone anything else. Yes, Reed, Charles Reed. Yes.
You investigated different shapes and pyramids for the.
How dare you? Yes, Jewel in the Lotus, last section of the Jewel in the Lotus. It's all in there. I have investigated them, and they are related to the rays. Questions, and these are things you can use in your healing clinic. You've all seen Bill Cox working with pyramids and others. There is so much that you can do. There is no time to bog down on relationship problems. Yes, who's next? Yes, Zeke, what can you do? Yes, go on then, let's have them in order. Now, I can't comment on Brenda's work in the sense that I can't give the same sort of answers that she might, but let's see if I can help.
How do you determine what is true intuition?
Well, there's a very fine book, From Intellect to Intuition by Alice Bailey. I can only answer this in my own way. When I use my intellect, and this hasn't always been with me, when I use my intellect, I can get some very finite and very acceptable results. When I use my intuition, however, and of course one can't switch it on. That's what Brenda was trying to tell you. You can't just switch it on. But when you do use your intuition and it's stimulated by withdrawal, I get a flash of light that comes down and sort of like a windscreen wiper goes right across my inner vision. That happens with me in intuition. It's been coming on a long time. And you may have completely different manifestations of it. I only know that in the beginning we have to use every device possible, and one of them is dreams. And where I think a lot of you are making mistakes is that you're coming to flash decisions. Not even the carefulest doctor will make a snap diagnosis without going into it later very, very carefully. Of course it's nice to be able to say, well, straight away, I think it's thyroid or something like that. But you have to be careful. And again, if you have been listening to what I have taught for years in this town, and you're keeping spiritual diaries so that you can open up a new page in your diary and you can put the patient's name down, you can put his history and his symptoms down, and then ask for light, O Lord, and that anything that comes through in your dreams and your meditation and your brooding for the next 2 or 3 days, you could say, well, there is nothing else that I'm putting. I'm only concerned with this individual. What is the difficulty here? Give me some light. Now, to me, that is the way. If you're so clever that you can pick up things like this, marvelous. But you be sure that you know what you're doing. And if you don't know what you're doing, it's because you haven't been following what I have been talking about and trying to demonstrate for 5 or 6 years in this town. You must keep a spiritual diary. You cannot just ask the masters to run around picking up rubbish from your minds. Next question. Yes. I'm afraid you've got to reword that for me. It's a little bit either too abstruse or too clever. I can't get it. What exactly can you be a little more specific?
There's difference made between low diaphragm and above diaphragm.
That's right.
Okay. It's possible working chakras above the diaphragm still have a personality that presents itself to the physical world that would, by its personality traits, indicate otherwise.
Vaguely, I'm getting the impression that there's inner conflict here.
It's more like much that observer.
Yes, the importance here is, you know, there's nobody in the world has been accused of using his ego more than I have. But there's one thing that I am certain of, and that is right motive. And if the motive is right, let the world go to hell. By your results shall you be known. If I worried about every carping criticism, somebody rang me up the other day and said, what's this I've got through the mail? I said, well, you tell me, what is it? He says it's International Festival, and it's got a picture of Tumour on it, all dressed up like an Arab sheikh or something. I said, what are you trying to tell me? He says, well, we don't like his picture on the program like that. You see. The silly devils don't understand that Tumour is the only person that we can really put our fingers on and say that he can demonstrate powers latent in man in such a way that I, as a doctor, am confounded and want to know what laws of nature are involved in it. So my answer to people who worry about little things like that is that let them get on with it. Life will weed them out. But if you are dedicated and your motive is right, I'm not telling you to discard advice, but if your motive is right, that's the most important thing. Of course you have to go below the diaphragm. Of course most female conditions are related in some way to a region below the diaphragm. And there are times when I know that's not what you're meaning here, but it's nonsense to say that the region below the diaphragm must never ever be a focal point. Of course it's got to be a focal point. And I could only say this, that even in discipleship, regions below the diaphragm have to be used, and it places more responsibility than ever that you use the right motive in whatever you do. I don't know if you'd like to put the same question again in a different way. Yeah. The thing that I don't like, to be perfectly honest, in this area is the element of constantly thinking that you have to resort to magical methods, to the concept that supernormal phenomena are at play, astral attack, and all this. Well, as I'm recording, I can't say it, but to me, that, as an occultist and as a medically trained person, is just anathema, and I can't stand it, and I will fight it to my dying day, to bring in all this unnecessary nonsense of, I could feel this force coming from him as I walked into the room, and it caught me just here, and God, I don't have any of that in my life. I don't want it, and you mustn't have it. For heaven's sake, you've got mechanisms in your life for switching things off. Use them. Put the switches down. Have nothing to do with it. And choose the circumstances of your own when you can radiate energy out and do your diagnosis and so on. And that's what I'm really worried about in this area. Now you can make your comments. Zeke, anybody. The lower psychic powers, yes. It is when the energies of the personality are being drawn upon to the exclusion of energies coming from the soul. It's as easy as that. It's nothing else. When the energies of the personality are being drawn upon or used to the exclusion of the energies of the soul. The more you can use the soul energies, the more permanent will be your healing. Yes?
Previous questions not before. Meditation helps sympathetic, parasympathetic nervous system, or does it just stimulate the parasympathetic system, since that regulates the building up process? Or
well,
the person happens to be a parasympathetic dominant glandular type.
Should they do it? I think that an analysis of meditation by anybody less than a master is an impertinence. And I'm not meaning this unkindly, Joe. I'm just saying it in respect of what it constitutes. Meditation has been the tried and most effective method that has been ever elaborated on this planet for bringing down solar fire. And solar fire is A, a normalizing energy, and B, where it is stimulating, it stimulates towards evolution. By that we mean the unfoldment of truth, beauty, and goodness. Now, the problem with meditation is that people interpret meditation as a discipline and all that goes with it. And of course, if you're going to control fire or play with fire, you must understand the laws involved, and there are disciplines for it. But meditation is purely and simply the bringing down of solar fire, or if you like, your solar angel into your aura. Now, there is nothing else to it. All the meditational techniques and everything are there for you to practice with and to choose from. And in the end, the important thing is to bring the solar angel down. He is this spark of the heart of the sun to reside in your aura. And meditation is playing with fire. And we're talking about solar fire, not fire by friction, but solar fire. And that's how I look on meditation. That's how I look on healing. And if you are doing this, that you are first of all flooding yourself with the energy of the soul, it will flush you out. And if your patient is all gummed up, it can flush him out through you. and it is fire. Now, if all your instincts were being used to be appreciative of this energy can talk to you. It can flow down through you so that when you hit a right diagnosis, you can feel it gush through you. Of course, if you're sitting in a crowded restaurant drinking coffee or having a fag, it's not going to be easy for that energy to register. But if you will have a place of your own that you can go into, or a healing room, what, please, will you do when you go into your healing room? Will you light up a cigarette in there? You see? You won't. Well, then why will you light it up outside? Because that's where you're going to do a lot of your intuitional work. And these things are just anathema to the downpour of that energy. Question? Yes?
Comment on the development of the Ajna Center, related to the state of personality integration. Ajna will be fully developed how full personality integration.
The Ajna can be developed by very simple techniques of powerful concentration and one-pointedness, involving great cruelty to those about you and to your own personality and bodies. And you can certainly attain its opening, but a safe way and the progressive way that leads to evolutionary unfoldment in terms of truth, beauty, and goodness is to unfold the Ajna center, irrespective of the condition of the personality, in relationship to the two other chakras, and that is Alta Major Center and the 1,000-petaled Lotus. And in my ashram, we encourage three aspects. Encourage them, don't lay down any laws about it, three aspects which all are invited to participate in, and that is the meditative way of life, that is brooding and pondering over subjective experiences, contacts, study of the classics, and service work. And those three activities will produce the opening of the three head centers in an evolutionary way. The opening up of the brow chakra can be achieved by a non-integrated personality, certainly, but it will lead to all the vices that can be associated with that chakra. It's nonsense to say that the brow chakra is entirely related to virtue. It's not. Nonsense to say that any of the three head centers are entirely related to virtue. They can be aberrant when they are overdeveloped, and the other two are not developed along with them. They can be aberrant. Yes.
Some of us can talk in type of inner vision.
Yeah.
You can see like organs of the body, the different sub-bodies, or receive impressions of them. It's inner vision.
Well, now, let's be quite clear about this. I mean, this takes us into what is sometimes taught in the field of mind control, isn't it? All right. I can only offer my own experience in this respect. When I was studying anatomy, it seemed to me that a way in which I could both do my anatomy and improve my powers of visualization, it seemed to me that if I could visualize the anatomical part, that this would be helping me in both fields. I would be studying anatomy. The blue. Very good saying, right, I want to find out a diagnosis of such and such a person or what I must do. I'm going to start tomorrow, keep a spiritual diary for 3 days and then finish with it. I'm sorry, but you, as I have said before, if I had $3 million, I could not bribe your way or my way into the kingdom of heaven. If I offered to build a clinic, if I offered to build a statue of Jesus, if I offered to do anything, the fifth kingdom would be just not interested in that. What they are interested in is that you will do the basic disciplines that will give the soul an opportunity to grasp its vehicles. No short circuits. And Zeke, if you ask me, that is lower psychism of the worst order, is to think that you can look without any medical training, anatomical training, spiritual training, occult training, that you think that you can look into a body and see a person's condition with such little training. I would say no, and I certainly would not risk it, not on my brother or sister or on my worst enemy. Yes. Yes. Now, this is a difficult question. I didn't say that. I said in the case in geriatrics of a very elderly lady who is already in dementia, which means that the brain is softening, that a lot of the cells have gone already, and she is losing her faculties, she's incontinent, she can't control her water and so on. Then the question arises, shall we assist this individual soul to extricate itself?
Are people without conscious awareness drawn to people who are terminal so that somehow
I think this is a good possibility, that if a person has a terminal illness, that they tend to attract, every time a person is sentenced to death, there are 1,000 nutcases on the phone to the prison who want to have interviews with him. And when you hear that somebody is terminally ill, people can be shocked and want to do something and help. Now, I'm not saying that this applies here, but it may go on at a mental level, that a person is in travail and will attract others. Astrological. It's an astrological thing you're going through. I've been surrounded with doctors for the last 3 weeks. Every seminar I've given, there's been doctors and medical students and goodness knows what, and I haven't had that for a year or two. Sometimes every chair I sit on smashes underneath me, and I don't have that happen again for 4 or 5 years. Or doors break up, or I can't get through them, things like that, and that's a Capricornian thing, doors and gateways. This is what I meant a little earlier, that one begins to use all these things. And I was just about to talk about biorhythms, because can we have my chart on biorhythms, please? It's lying around somewhere. I think it's behind here. And this is something else I think that we should use. I think that everybody in a healing group should have a biorhythm done. It's so easy to get them done. And when periods are difficult, that the people who have a difficult period in biorhythm should bow out of the healing group during that period of, I just want to illustrate something, of 2 or 3 days. And we need to use these devices more and more. Yes, that's it, thank you. If you've got any tape to put it up with. It's hardly worth spending tape on, but I'll help you with it. It's not that important. But we live in an age where a lot of us might not have the intuitive perception of some clairvoyance, but for heaven's sake, let's use what we can. Now I'm a skeptic if ever there was one, and but I do like devices and instruments, and I've looked into biorhythm before, and I have found that for me it works. And somebody very kindly, a friend of mine at the Columbus diploma, somebody came up and said, I've got your biorhythms for the last couple of months and months ahead, would you like to have them? And I said, yes, show me March, because there was a day in March that I felt awful, and some of you might remember it. It was the Sunday of the diploma certificate, when we were at the Holiday Inn, I think. And on that Sunday, I really felt awful, and I remember saying that I would run right through and get away early that day. Do you remember? Well, that was a bad day for me, and I very rarely have a bad day physically. And I asked to see this month, and there it was. What was the date? It was a Sunday. Can you remember what date it was? 7th and 8th. Well, there it was, right there. This was my difficult day, and I know that on the Monday, I was really tired for the whole day, and people around me remarked that, there was something wrong. And I just said, I'm just very, very tired from that seminar. And the whole of that Monday, I was completely out for the day, relaxing. And it was just this awful period round about here that I went through. And I have noticed that before. I've noticed that before. I've had an occasional day which stands out, a day or even 2 days, that stand out vividly in my mind from a health point of view. And invariably they coincide with a trough like that. Of course, there are many ways of interpreting these troughs, but generally speaking, this would appear to be a coincidence of physical, emotional, and mental coincidence here. And I think that that's a bad time to expect a healer to be functioning. I think it's bad occultism. And I think that also that the biorhythms of every patient should be had. And that when a patient, whether he can get to the clinic or not, has got a difficult trough like that he should be put down in the book immediately. You know what I'm talking about, the book now? A book that is in the most prominent part of the healing chapel or clinic or whatever you like to call it, and should receive consideration on that day. Yes.
You mean just a physical line, or you mean like when two lines?
Well, I'm not an expert on biorhythms. I only know that when the 3 lines met in the trough at the bottom there, I had a very, very difficult period. Well, for me it was difficult.
Well, I mean, like a healer shouldn't work and just mainly physical or physical?
I would say the 3 together for sure. But experiment. Maybe there are implications here, but none of you experiment. You're all whizzing around with vague ideas and interpretations and so on, and very, very valuable material like this is being ignored. This is our work. Our work is to be frontiersmen and to force this material on until the medical profession and others take it into account. That's what we're here for. Yes. Yes. Ruby's got one. Stand up, Ruby. This is your big moment. Ruby's got one. Very nice. Well, that's an example. 31st December 22, 31 December 22. Right. So this is what I meant anyway when we were talking about using devices. We're going to have a break, and I'm determined to complete the little piece on alcohol, treatment of alcoholics, and do the section on cancer tonight. So go and have a break for 5 or 10 minutes. Have had some valuable time spent here today on sorting out some interesting problems. And I think I have given you a glimpse of how an esoteric healing group can start off on a good footing. And by having a site where healing can be done increasingly, you of course attract the most important thing of all, which is the healing devas. And when the devas are not frightened away, when they have more than anything a habit, a sort of a ritual that has gone through, and they can recognize, for instance, when a great invocation is being said, they can tell from the rippling waves of light that come from it that this is a center where they can not only draw but exchange energy. Then you've got the making of a healing center, And devas tend to love some people and less so others. And that is why you always need to have a variety of individuals in your healing group. And don't just throw them out because they don't think and feel like you. As long as they have dedicated themselves to a single motive along with you, that is enough. Now, the subject of cancer. The first thing we have to remember is that science has virtually eliminated infectious diseases in the last 150 years. I don't know what the situation is here, but in England, all the old hospitals that were used for infectious diseases have now been turned over to geriatrics for the care of the old age, for old people. And it is, of course, a great tribute to the medical profession and to advancements. in nutrition and so on. But the great killers of 80 years ago have virtually been eradicated, and few people die before old age today of disease. But there are two killers that remain. One of them is arteriosclerosis, which is narrowing and hardening of the arteries, with the resulting lowering of blood supply to various organs, especially the brain and the heart. And the other condition that kills in old age is, of course, cancer. And cancer kills usually when it spreads. Cancer kills when it spreads. Whilst a tumor is confined in a particular region, either by the natural forces of the body or by limiting membranes, it doesn't kill. It's when the cancer spreads, when it is able to break out from its narrow confines, or when pieces of the cancer pass via the blood system to other regions, that the cancer kills. So that is worth remembering, and it has its esoteric implications. About 20% of all deaths in England are as the result of cancer. There are about 100 different kinds of cancer. The kinds of cancer depend on the tissue where they are found. Generally speaking, we talk about carcinomas as being cancers which arise on the surface of the body, the surface of the skin, on the surface that runs through the body, a long tube of the alimentary canal, or on the linings of tubes, the surface lining of the bladder, anywhere where there are surfaces on the body, not just the outside skin. We call these carcinomas. When the swelling is in the blood, we call it a leukemia, and when I say swelling, I mean the carcinoma, the cancer is in the blood, we call it leukemia, and if it's in the lymphatics, we call it a lymphoma. When it's in the muscles or the blood vessels themselves, or where there are any fibers, we call it a sarcoma, and that's just about all that you need to remember. A carcinoma on surfaces, a leukemia or lymphoma inside the blood system, or a sarcoma where there is muscle and blood vessels. Now, unlike death from stroke or from arterial disease, death from cancer is usually long and drawn out. It's usually long and drawn out, and very often it is painful. And so we're talking about a kind of death. When you talk about cancer, remember it's the kind of death that you're talking about. Not just a sudden accident, a heart attack, but a long drawn-out process which is painful. And I stress this because it indicates karma. It indicates karma. Sudden, quick death works off no karma at all. Sudden, quick death works no karma off. Only when the death is long and drawn out is there karma involved. Another strange thing about cancer is that it seems completely unrelated to the environment. It seems almost completely unrelated to the environment. Seems to be no reason, except for a few examples, why such an environment should permit cancer in one area and not in another. And because it is so unrelated to the environment, it is so difficult to prevent. And preventive medicine in cancer is something which doesn't play as big a part as it might do, for instance, in infectious diseases. We have to remember that cancer expresses the main karma of Atlantis. Cancer expresses the main karma of Atlantis. The evil karma of Atlantis is not yet worked off. The evil karma of Atlantis is not yet worked off. And some of us, even myself, will go down with this disease inevitably, And the older we get, the more likely it is. The more likely it is. Now, before we go into that, let's talk about the difference between benign cancer and malignant cancer, or benign tumours and malignancy. We mean that a thing is benign. You heard Brenda talking about this with regard to breast lumps and so on. We mean that a thing is benign when they can't invade nearby tissue and they remain local. So that would be regarded as benign when they remain local and they can't invade and they don't move or metastasize, allow parts of their tissue to migrate, as it were. When they can spread and invade them and feed up. Now, about 50% of cancers occur in 3 sites. About 50% of all cancers occur in 3 sites. They're the worst offenders. The lung, the breast, and the large intestine. The lung, the breast, and the large intestine. Shall I give you a short little anatomy to show you what the large intestine is? The small intestine begins with the duodenum and a long, narrow tube that fills up most of the central part of the abdomen and enters the large intestine just about where the appendix is, at the ileocolic valve. Now that is the small intestine. The large intestine makes a sort of picture frame to the small intestine. There it is, like that. Begins over here on the right side with the ascending colon, the horizontal colon or transverse, the descending colon, the rectum, and so on. And that's the large intestine. So there is one of the 3 sites of the worst offenders in cancer, the breast also and the lung. And then we get strange characteristic patterns of it. For instance, 4% of people in Tennessee have skin cancer. And it looks as if there are environmental factors or genetic factors involved and so on. And the esoteric teaching is quite clear that cancer is a genetic condition, that it is hereditary in every instance, although there may not be evidence of this, that it is hereditary in every instance, that there are streams, there are stocks of people who have Atlantean blood, if you like, origin, genetical backgrounds to them, and I'm one of this group. Skin cancer, I think you should see this. Has anybody not seen skin cancer before? The characteristic is, if you want to come up, you can have a quick look, because you should recognize it. And one of the reasons is to be able to warn people that there's time for them to come out of the sun. Now, that arm has developed skin cancer through being stuck out of a window driving. And you get the sun on it all the time, and coming from an Anglo-Saxon background where fair skins predominate, you get white patches which flake. White patches which flake off. And they don't go away, they tend to last. And as much as you flake them, they will flake again and again. And the moment that goes into the sun, other patches they're quite harmless, they never spread, they're always localized, they're harmless as long as you don't provide the stimulus to them. So this is an example then of a non-malignant condition, and it's worth watching. That arm is less so because I've done most of my long driving in an American car, although I've done some in an English car, and the sun in England is not dangerous, and the sun in America is dangerous. All right? So it's worth recognizing. Pardon? Yes, you shouldn't allow that to be exposed too much. The fairer the skin, and the less pigment in it, the more likely to develop the condition. All right. And notice there's calmness about it. And for heaven's sake, if you are an esoteric healer, treat all gently. Remember the second ray? Treat all gently. Never allow your emotional nature to well up in a healing center. You must constantly give an impression of quiet confidence. Oh, I've got skin cancer. Oh, and all that sort of nonsense. A person that has a terminal condition is a person who ideally should go to his death without emotional hemorrhage. The soul would like that person to terminate his life in a mental orientation towards it. No emotional deluges. And that's the sort of and there's a delicate balance, otherwise people think you're callous. I can't bear emotional upsets around me because of years and years of disciplining the emotional nature. Use the emotions by all means, but don't allow them to run riot. By the time we reach middle age, anyone has several nests of proliferating cells. And indeed, it is the occult teaching that we all carry the seeds of cancer, the Atlantean stock in us, some of us more than others. Now, when you take the example of cancer of the large bowel, which is what we've been talking about, from the age of 20 up to the age of 80, the chances of contracting cancer of the large bowel increases 1,000 times. If it's one chance at the age of 20, then there are 1,000 chances by the time you're 80, 1,000 times more chances. And so we say then that cancer tends to be a disease of old age, a disease of old age. And indeed, it is a very, very old disease. And under occult law, it tends to attach itself to the old. Many people say that this indicates that cancer could possibly be as the result of mutations of cells by extraplanetary forces, cosmic forces. In a young person, they have only mutated or affected him slightly, but with the progress of time and constant exposure to cosmic forces, that this inevitably makes a person more susceptible. Mutations occur. Now, the esoteric teaching is that we cannot stop cancer entirely by treatment from the outside. We cannot stop it entirely. We can merely make it, as it were, go into latency, so that the latency may not even show again in this life, but it will certainly show in the next life, or the one after. What we're really saying is that occasionally we get cures, we get cure conditions. I'm having trouble here today, I don't know why. And generally speaking, the cancer likelihood comes in a sort of waves spread over several lives, and it diminishes. If you happen to get a patient who is, as it were, on the stage of becoming less likely to be involved in the condition, that's one life, another life, another life, and he is treated here, then there's a better likelihood of the cancer being stopped in its tracks. But if they are in a series of lives which is taking in the karma of Atlantis increasingly, then there is very little likelihood that the cancer can be halted on this upgrade of the wave, as it were. And no matter what you do in such a situation, the thing will burst out elsewhere and manifest itself. So by this method, one could say that, bearing this in mind, Apart from this, it's just a matter of luck, that if you happen to be on a downward scale of manifesting the karma of Atlantis, then you can throw the thing off quite easily with a minimum of treatment, perhaps. But if you're on a stage of surging upwards, and this would certainly be true of less developed people, that they would tend to have still a lot of karma of Atlantis to work off, whereas others, some of us who have had lives in many Atlantean civilizations, we would have just about worked our share of the condition off. Now, we say that it's all very well to take preventive steps, and certainly no one suggests that you shouldn't. Some say that circumcision reduces cancer of the penis. Some will say that keeping out of the sun will reduce the likelihood of skin cancer, or stopping smoking may reduce lung cancer. But then, of course, many people get lung cancer who don't smoke, and many people will get cancer of the stomach without even touching Chinese food. And therefore, we merely say that the outer stimulus is not the cause of the condition. It triggers it off. It triggers it off. And two people who may be very light skin may be exposed to the sun, and the one will develop skin cancer and the other won't. We merely say that it has been triggered off in one, but it will not be triggered off in the other because the cause isn't there, or the latent causes aren't there. We also say hereditary is a factor, and despite the work done on identical twins, this hasn't been proved by science yet that hereditary is a factor. We say it is. Prevention by finding causes is possible from an occult point of view, but so long as science looks at the matter entirely from without the ultimate stopping of the disease will not occur. Many possible causes of it. I want to just go into the subject of metastases. Metastases, because this is the most important of all aspects with regard to cancer. And it's usually the metastases that kill. Now, the strange thing about a cancer is that it is malignant, it will metastasize, but it will tend to metastasize to certain organs only. It will to certain organs only. For instance, the prostate gland, a cancer of the prostate gland will nearly always metastasize to bones. And the pieces of the malignant prostate will travel in the blood system and they will go to bones. Now, this is a very clear example of ray sympathy. The prostate gland is part of the seventh ray, the gonads, the sacral center, and the bones themselves are ruled by the seventh ray, the densest aspect of the physical body. And whatever the pathology of the situation, we have here a clear ray, as it were, attraction between two sets of organs, prostates and bones. The lung generally metastasizes to the brain. The lung metastasizes to the brain. And also we have the relationship of stomach to ovaries. I haven't worked this out yet. It may take many years to work it out, but generally speaking, they apply on a ray basis. They metastasize on a ray basis. Important, because if the carcinoma site is known, where there is a carcinoma, then preventive medicine, by that we mean esoteric healing, can be applied to the possible sites where they would metastasize in advance. We say that if the amount of emotional energy which is pouring into the hypothalamus can be controlled before it reaches the organs like the hypothalamic nuclei, that even metastases can be diminished in sense of their danger. In other words, we say that wherever a metastasis lands, it still has to have emotional energy, energy to make it grow. And so we say that the site of esoteric healing for cancer is the hypothalamus, and that's why I went to all the trouble earlier in the talks to fit you in with the hypothalamus. And if you're going to direct any energies, emotional or mental, to the patient, visualize the hypothalamic region so that the normalizing energy of solar fire can flood this region. The normalizing energy of solar fire can flood the region so that then the metastases are not, as it were, fed, not fed with energies that are thinly veiled in what really become driving energies, the four drives that I mentioned earlier. And in cancer, these four drives, frustrated, pour into sites of metastases. What we can also do is, more than anything in cancer, is to stimulate the heart region of the patient, stimulate the heart region. Now, I have given the techniques for heart stimulation in my treatment for depression. And as we're not going to get the treatment for alcoholism in tonight, just let me say that the treatment for alcoholism is basically the same as the treatment for depression. By that we mean the cultivation of the love aspect. Where there is indifference, cultivate consideration. Where there is wrong motive, cultivate right motive. And if you look carefully into the subject of what I gave out at the diploma in respect of depression, I listed them very carefully there. The cultivation of heart qualities, love qualities, you've got the answer to that. Now, and so what you need to do is to bring out the heart qualities of the patient in order to mop up, to transmute, to bring the energies of the solar plexus chakra, which are being frustrated, into the heart region, and the more powerfully you can do this, even if it doesn't save the patient, at least the life would have been rewarding. The life would have been rewarding. Now, there is a method that I recommend. There is a method that I recommend, and this is to use Weleda. It's on the board, Weleda, and it's the mistletoe preparation. I'm not quite sure how it can be done, but if you can find out from this end whether they can be posted to you from England. If any of you write to me in England, then I can let you know the appropriate amount. I can send them to you from England, and as long as I do it in England, that's quite all right. Yes? Don't know about it. I've heard a lot about it, but I haven't investigated. I think that's a drug, isn't it? Do remember that the myth... Status quo. Yeah. Well, by all means, you use other methods. I've just suggested these, and to me, I have checked up on the Weleda method occultly, and I know that it is valid. Question.
Does the liver ever spread, or is that just the
liver? Mm-hmm. What do you mean? Do you mean cancer of the liver?
Right. You were speaking up there. Is it?
I think cancer of the liver metastasizes to the brain. Mm. I think I've dealt with that in esoteric healing. I can't remember whether I said the karma of it. Something about the causes of it. there has been ultra-sensitivity of the individual to experiences of others, rape cases, anything to do with sexual sort of violence. Certain individuals, women, are very, very sensitive to it. They pick it up by means unknown, they read about it, they visualize, they are en rapport with people who've suffered it, and this can be a very potent basis for them. And also where there is great aversion, not necessarily for the husband, but for many aspects of the whole sexual expression, not their own, but in general. I think I wrote about that very delicately in Esoteric Healing. Question? Now, do you honestly think that there is enough interest for us to take this to another stage in about 6 weeks' time if I'm going to be here? Or do you think we should let it lie to the fall? I don't mind. We don't make money on these things. You know, a room like this costs $100 a night to have it laid out just in a classroom style. And when there are 2 speakers, and I would always like to have 2 speakers if possible, you don't make anything out of these things. And so really and truly we always like to know if people are keen enough and to have another one. I'd like to bring a young doctor down from Cincinnati next time, if possible, and someone that you can have up here pretty regularly. He's medically qualified, he's esoteric, he's thoroughly into this work, and he has lots of interesting ideas, and I'd like him to come down here and talk to you. Would you like that?
The homeopathic like that?
He has homeopathic ability, but that's not the homeopath I'm bringing from England one day. That's why I say it's so important that you all hold together and integrate together, because this is the only group in town that could really afford, when I say afford, who would afford to have quality speakers here. By quality I mean medically qualified people who are esoteric is a good example, people like Brenda and so on. So do remember you're performing a service to the community if you can hold together, and especially if you can attract interested people who are really interested, nurses and potentials for your healing groups. Our aim has been in this certificate seminar, and I wanted to ask you about certificates tonight. Some of you say that you're not concerned about any sort of diploma certificate, and this may have some advantages. On the other hand, I do think that from my point of view, I would like to be able to say that certain individuals have a standard which has been certificated so that we can know in the future that they can be relied on. You know, a lot of you here could as you well know, would not have been able to take the stuff if you hadn't had the backgrounds that you have. Some of you have, heard me speak 30, 40, 50 times? Must be. And have been through diploma courses, and to you just take it in easily. And that's very important, because it means that I can be very relevant here. Whereas if I'm constantly going in to describe what I mean by an etheric body, it's no good at all. So don't lose ground. Don't lose ground at all.